I need help. Excuse me. I need help for the present. Hold on the presenter view. स्लाइड शो में जाके मूव नहीं हो रही थी यहाँ से अब होंगे ठीक है Good morning, respected chairpersons and all faculty members and dear colleagues. This topic, which I was given initially, seemed very unusual for a gynec conference, midlife women and pets. At first glance, pets may seem to belong to veterinary medicines, but however, when we look closely, pet ownership intersects with many issues that we manage every day. Menopause, osteoporosis, pregnancy, allergies, immunosuppression, and healthy aging groups also. So let's begin with why this topic is becoming increasingly relevant. Recent estimates suggest that approximately 32% of urban Indian households own pets. India today has nearly 32 million pet dogs and around 7 million pet cats. At the same time, more than 50 million Indian women are affected by osteoporosis after menopause. As Dr. Pragati has just very well illustrated, osteoporosis and this leads to patients become more prone to falls. We also care for pregnant women, women undergoing cancer treatments, women receiving biological therapies, and women with chronic medical illness. So now imagine a post-menopausal woman uh, who is having all these problems. Whenever we discuss pet ownership, we must maintain balance. The benefits are definitely significant. Pets provide companionship, they offer emotional support, they reduce our loneliness also, and also for many women pets become family members, as you many of you must be having. However, there are also important risks. They include falls and fractures, bites and scratches, allergies, asthma exacerbations, and zoonotic infections. The message is simple: the answer is not to avoid pets, the answer is informed counseling. The emotional connection between humans and animals is remarkably powerful. Study shows that nearly 87% of pet owners report that their pet reduces their stress significantly. And interaction with pets have also been shown to stimulate the oxytocin hormone release, the same hormone which is associated with maternal bonding. Another interesting finding is that dog owners are approximately more likely to achieve recommended physical activity levels. Let's look at some data. Pet owners have been reported to be nearly 3 times less likely to experience severe loneliness compared with non pet owners. Even a brief interaction with the pet can have measurable physiological effects. Studies have shown around a 28% reduction in cortisol levels after only 10 minutes of pet interaction. This is particularly relevant because loneliness is increasingly recognized as a public health issue. In India, loneliness is estimated to affect roughly one third of Indian urban women. One of the most practical benefits of pet ownership is increased physical activity. This has implications far beyond fitness. Regular physical activity improves cardiovascular health, helps control weight gain, improves sleep, enhances mood, and contributes to better bone health, as you all must agree. For a menopausal woman struggling with inactivity, a pet may serve as a a pet may serve as a natural companion. Now let's move to a risk that receives far less attention: pet related falls. Uh, we can skip this also because this is very common. The mechanisms are surprisingly very simple. A dog suddenly pulling on the leash while you are taking the dog for walking, a pet running between the legs. With increasing age, visibility sometimes decreases. Poor visibility at night, a pet sleeping in your room and you tripping on the pet, or attempting to stop a escaping animal. For younger individuals, these incidents are usually minor, but for an aging person, they may result in severe injury. This is where the issues become more important for the gynecologist. India has over 50 million women affected by osteoporosis. When the osteoporosis combines with a fall, the consequences can be devastating. As we all know, hip fractures alone carry mortality rates approaching 20% within 1 year. Vertebral fractures frequently go undiagnosed and many may be dismissed as normal aging. Wrist fractures are often the first warning signs of underlying skeletal fragility. We must also remember sarcopenia. Loss of muscle mass and strength further leads to patients being more prone to falls and risks. Uh, we can skip this. Let's now move to fractures from fractures to infections. India reports approximately 7.5 million animal bite cases annually, the highest number globally. Most of them involve dogs. Many bites are uncomplicated. However, certain infections can become serious, particularly in women with diabetes, cancers, steroid therapies, or who are already immunocompromised. Pathogens such as Bartonella, streptococcal, and especially rabies virus, they are very important. And because we are practicing in India, rabies is since rabies is a fatal disease, we all must know about the precautions and we must know how to uh, uh, treat the patients. So, what should we do when a patient presents after a bite or scratch? The most simplest answer is washing with soap and water. Next step is to assess the tetanus situation also and evaluate the rabies exposure risk. And then, accordingly, we can counsel the patient. And if needed, we can also refer the patient. Let's now move to allergies. One of the most common myths patient asks is whether certain breeds are hypoallergic. The reality is that no pet, no dog, no cat is truly hypoallergic, except even if we follow many mitigation strategies in the home. Like for example, we should not allow pets on beds or in the bedroom. Frequent bathing of the pet and regular hygiene, if it is maintained. Even then, there are certain allergies which can be there. Asthma, for example, affects approximately 37 million people in India. Among them, around 20 to 30% are sensitized to pet allergens. When pets are excluded from the bedroom, HEPA filters are used, regular cleaning is performed, approximately allergen loads can be substantially decreased. Many patients experience fewer exacerbation and improved respiratory control. An interesting observation from research is that the persons who are exposed to these allergens earlier in life, they have better immunities. Now we come to one of the most important slides. How many of us have um, heard a pregnant woman asking, "My doctor has told me to give away my cat"? Unfortunately, it is very common. The evidence, however, tells a very different story. The main transmission route is undercooked meat and unwashed raw vegetables, not the cats directly. So, if the pet cats who are fed on commercial food and homemade food, they are actually not posing threat. So, if they follow proper hygiene, they can be kept. So, what should we actually advise? The focus should be on practical preventive measures. If the woman must do it herself, she should be using gloves if she is handling, and the cat litter should not be handled by the pregnant woman. Risk assessment becomes particularly important in immunocompromised women also. A woman receiving chemotherapy has clearly different risk compared to a healthy postmenopausal woman, as you all must agree. So, this does not necessarily means avoiding pets altogether. Rather, it means reducing exposure to high risk situations. Following good hand hygiene, avoiding bites, and following standard protocol may help in reducing all these risks. As a gynecologist, there are few zoonotic diseases that we should be familiar of. Rabies remains still the most critical because of its nearly 100% mortality rates, and toxoplasmosis become relevant during pregnancy. So, what we should start doing from next day onwards, I suggest a simple four-step approach. We should ask all the patients whether they are having a pet. Secondly, we should assess whether they are at risk, whether she is osteoporotic, if she is pregnant, or she is immunocompromised. Third, we can counsel her accordingly. A menopausal woman may need fall prevention advice also. I'm just concluding. As I conclude, I would like to leave you with five key messages. First, the most midlife women, the benefits of pet ownership outweigh the risk when appropriate precautions are taken. Second, falls and fractures deserve far more attention, particularly in postmenopausal women with osteoporosis. Even a small dog can occasionally result in devastating fractures. Third, we must stop perpetuating the myth that pregnant women needs to give away their cats, and evidence-based toxoplasmosis counseling is more important. A healthy, vaccinated, well cared for pet is both a health asset and a low risk companion. Thank you.
Thank you so much, ma'am, for such a
I hope I
systematic
finished in time.
lecture and debusting some of the common myths related to having pets. It was really very enlightening.
For the next talk, I would like to invite Dr. Aradhana Gupta. The topic is IVF after 40. Is it mandatory? The chairpersons for the same are Dr. Madhuri Krishnani, Dr. Diksha Prakash, Dr. Aparajita Chavla, and Dr. Himani Gupta. I would like to invite Dr. Saurabh for chairing the session.